My name is Nadia Jafari. I am a behavioral health resident at Auburn North at HealthPoint. I chose to do a residency position here because I wanted an additional year of training in the primary care behavioral health model. I feel like 1 year just isn't enough to get all that you can out of it. I've also really wanted to get more knowledge of medical skills and medical education. And being a part of the residency at Auburn North Clinic in particular, I have the unique opportunity to see what it's like to work with faculty, part of a residency training program. And so I'm learning a lot about medical topics and also have the opportunity to teach faculty and residents about behavioral health science topics. So working with faculty at HealthPoint has been really crucial to my development as a trainee. Faculty here is so supportive, especially in the Auburn North Clinic. They are working with medical residents, and so they see me as somebody who's also learning and just really willing to help me grow as a learner. I can say the same for behavioral health faculty as well.
My name is Melissa Baker, and I'm the Behavioral Health Education Program Director. We created a residency program at HealthPoint because we had a lot of interns who were doing their pre-doctoral training year with us who wanted to do a second additional year of training with us so that they could have a residency opportunity to gain more experience in the primary care behavioral health model and to get more exposure to working with interdisciplinary teams. But we also recognize that there may be other trainees who are doing internships at other healthcare systems or have interest again in working in interdisciplinary care. And we wanted to create this opportunity to get that more specialized last year of training and to be able to hone those skills for future work and working in interdisciplinary healthcare.
My name's Caleb Nixon, and I am the Behavioral Health Postdoctoral Resident at Kent Primary Care and Kent Urgent Care. And I initially started at HealthPoint in 2018 with my pre-internship and stayed during my internship and also my postdoctoral residency. HealthPoint offers a really dynamic training experience that not a lot of other sites have the ability to offer. There's a high level of diversity that we see at HealthPoint, both at CTAC and at Kent, the different sites I've been at. And also you get to be in a medical setting, which is really unique for psychology and behavioral health settings. And because of that, you get to see a wide variety of diversity as well as a higher number of patients than other settings, which has really attracted me and kept me at HealthPoint, along with working with really dynamic and fun care teams.
So far, we have had several residents who have had the opportunity to stay on as staff. So it's been really exciting to have trainees, especially residents, who choose to stay on at HealthPoint because they love the work that we do, and we want to create opportunities for them to stay in our healthcare systems. But for residents who do choose to leave and find work elsewhere, we hope that they bring with them both the clinical training, the mission that we have at HealthPoint, and all of the opportunities that they have gained in their training year with them as they move forward in their professional career.
I'm Brian Johnson. I'm one of the behavioral health consultants here. I've been working for HealthPoint for about 1.5 years now. And I finished my residency program this past August and then was hired on as full-time staff. My main goal of residency was really to learn how to function completely independently as a provider and provide really top quality services in a very high-paced environment. And I think I was able to attain that goal by really setting it out from the very beginning. Providing to my supervisor what my goals were, and to the clinic to let them know that, hey, my goal is to be as effective as a team member on the primary care team serving the community.
For the past 2 years, I've had the opportunity to be an individual supervisor for residents. And what really excites me about having residents at our clinics is the ability to provide that additional professionalism and discussions around professional identity, how to become a leader, some of the administrative opportunities that we have to work on workflows or to just provide improved systems for providing patient care.
Most recently, I was able to lead group supervision for the behavioral health interns. And usually what we do in that is we do check-ins, we do consultations and mock supervisions. Just being able to oversee that process and understand how they're developing themselves as supervisors was really, really rewarding for me.
So currently, given the COVID-19 pandemic, we offer a lot of different opportunities for our trainees to still get supervision or additional trainings. So we do that either over the phone, or we've been using virtual platforms like Zoom or Microsoft Teams, or there's still the option to do some face-to-face supervision, and we base that upon each individual trainee's needs and preferences. And so it's been wonderful to be able to see our healthcare system adapt during this pandemic and still be able to provide all of the training experience and requirements for learners to have a good quality experience.
It's been interesting to be able to step into the role of leadership as stepping out of an intern and into a resident's shoes. But again, feeling really supported by faculty in doing that. I've always felt that I can consult with them at any time and also come to them with any patient issues that I have questions about. So it's been actually a really wonderful learning experience here.
I've learned so much over these past 3 years. It's been a very cool experience to reflect back on where I was and where I am today. And I would say you have an amazing training program that allows you to enhance your clinical skills in working with very diverse populations in a very brief context. And overall, you learn to utilize brief treatment and treat a wide variety of aspects that walk through the door. And it's a very dynamic training experience that allows you to have scheduled patients as well as warm handoffs same day, which keeps you on your toes and makes it a very fast-paced learning environment.
For more information about our behavioral health residency program, please follow the links below. We look forward to your application.